Hi, I'm here with Rebecca Estes, a senior planner at the Columbia Boone County Public Health and Human Services Department. And we are going to talk today about the process for distributing vaccines in Columbia and Boone County for COVID-19. So Rebecca, just to start off with, why don't you tell us a little bit about who you are and what you do at the health department?
Sure. So planners at public health, but my niche, if you would like, is emergency preparedness planning. And one of those plans that I've been working on since I've been hired in 2014 is a mass prophylaxis plan, which is how to combat whatever public health concern is going on at an emergency level.
Okay, great. Thank you. So you've been sort of managing the rollout, I guess, for a better word, lack of a better word, at the department of the vaccine, and what we are doing as a piece of that puzzle. So I'm going to go ahead and start asking you some questions that people have been asking us, so that maybe we can tell them what's going on and show them the gears that are turning behind the scenes.
Sounds
Uh,
great.
so to start off with, what is the process for vaccinating people in Columbia and Boone County against COVID-19?
Sure. So for the most part, the state of Missouri defined priority populations that entities providing COVID-19 vaccine must follow. And so Columbia Boone County Public Health is one of those entities, as well as the hospitals in our area. So currently the phase of individuals who are eligible for vaccine is what you might have heard referred to as 1A. And 1A includes long-term care facility residents and staff, and then healthcare workers who are patient facing. So someone who's not able to work from home because to provide that healthcare, they need to do that in person. Vaccine providers in our community have reached out to businesses and practices which fall into that category, asking for information to determine the amount of vaccine needed to bring into the community to meet that 1A population need. So whenever a vaccine becomes available, like one of the providers receives a shipment, the same community providers are scheduling a time then to vaccinate entities that fall into that 1A. And we've done a really good job, we feel like, getting out to everyone. But if we've missed someone, so if you feel like, oh, she just described 1A and that's me, and you've not heard from a vaccine provider, so public health or another hospital or maybe a pharmacy, send us an email to covidvaccine@como.gov, and we will send you the tool that we're using to collect that type of information.
Great, thank you. And just to clarify there, so I know people have been hearing the term long-term care facility a lot, but when we say that, that generally means like nursing homes, right?
Right. High skill nursing assistant. So yeah, you long-term residential could mean a lot of things, obviously. And so yes, the care facility, such as, I think the kind of nomenclature would be nursing home, or skilled nursing facilities.
Great. I asked that question because a lot of people have been asking, what about nursing home residents? When are you going to vaccinate nursing home residents? And I just want to make sure that people know that that is actually happening, even if it's
Right.
not necessarily the health department that is doing the vaccination, right?
Exactly.
Yeah.
Exactly. As I mentioned, even some pharmacies have applied and been included as a 1A vaccinator. And so even the bigger chains like Walgreens and CVS are providing vaccine to that population as we speak.
As we speak. So we're
Mhm.
not the health department is not the only um, group, entity, organization, whatever that is providing vaccines right now, right?
Absolutely. So we don't have an all-inclusive list at this time of who's actually received it, but we know who's been approved to receive COVID-19 vaccine. And then we also know that other people are applying and just still working through the meeting the requirements to do that. But both are big hospitals, Boone and MU, and then the VA obviously is providing vaccine. So it is a multi and community effort.
Okay, great. And the state is really sort of the centralized locus for that, not the county or the city, right?
That's right. So each of those organizations that are providing vaccine are getting it from the state with the state approval, and the state's giving guidance on who they should be vaccinating.
All right, thank you. Okay, I'm going to move on to this next question, which
Okay.
is not necessarily a specific one that people have asked, but is something that I think is important for us all to be thinking about and know about as we look at the planning. So, how is this vaccine and this vaccine rollout different from past vaccination campaigns we've had? I mean, we talk about lessons learned from the H1N1 epidemic and the annual flu vaccine, which, of course, the public health department does take a very central role in. So how is this different?
Right. So the flu vaccine every year is developed earlier than when we start providing vaccine in people's arms. It happens early in the year, or usually around February and March, that the manufacturers are looking into what is the emerging virus that is coming that's not covered in the current vaccine. And so that's what they create for the next vaccine go around. But it's always just slightly changing a formula to be meeting the newest, most emerging vaccine. So it's like an update to a vaccine, where H1N1 was different than the annual flu because it didn't hit that mark in February, March. Nobody was seeing it. And so when the flu season hit, people were getting sick with the strain that wasn't expected. But again, we were able to still use that same base formula. Not we, like the United States and the manufacturers were able to use that same formula to pull in the H1N1 information into it. So it did require another vaccine, but the base was still the same. COVID is different in that there isn't a base vaccine that existed last year that we were anticipating that we might have to tweak a little bit. And so that definitely delayed how long it would take to create. But we were still able to do it quickly in that manufacturers were looking for a new way to target viruses. Research was being done already. And so when this problem occurred, they were like, hey, look, we have this new thing that we think might work. And so they were able to put it into play right away and then focus their efforts on that. So the rollout is a little bit different. Flu vaccine that comes out every year. You can go get it from your pediatrician or your local pharmacist. H1N1, when that rolled out, the state made arrangements with every local public health department and gave them the H1N1 vaccine and said, work within your community and then redistribute to providers. COVID is a little different. The state is working directly with vaccine providers instead of going into a community and finding one location to redistribute. So that not only is how it was developed and why it was developed is different, but then how we're pushing it into our community is different, in that the state is taking a more direct relationship with the vaccine providers, where H1N1, the state was making a relationship with one entity to redistribute to the community.
Okay, thank you. So that's how it's a little bit different. And that's why we're seeing it happen differently, the process, the rollout. But
Right.
what are the other complicating factors in terms of just getting shots into people's arms? Like, why are we not already having mass vaccination clinics?
So the manufacturers are still making the drug. I've actually heard a few public health professionals say this is a good problem to have. We have more people wanting the vaccine than we have the vaccine. So it is good that we have a big high interest level in it. But the reason why we're not able to do giant mass vaccination clinics is because it's just not available from the manufacturers yet. They are ramping up production and changing their lines of production to meet this need. And then it requires, it to be moved into communities that didn't already have a way to receive it. Another thing is this, especially Pfizer, when it was rolled out, it was ultra cold. You might have heard of ultra cold storage. And so lots of pharmacies and other medical clinics didn't have, even their regular freezers couldn't reach that ultra cold temperature. So to be approved to receive vaccine, you have to show that you can maintain that temperature safely. And so lots of people had to go out and buy that or create a workaround with dry ice. So the logistics piece, thankfully, that kind of was coming out before FDA approved it. And so plans were being put in place, but that, was just another step that made COVID vaccine just a little different than vaccines that have been provided in the past.
Okay. And then it's also a little bit tricky, right? Because beyond the storage, it's a little bit it's pretty unstable, right? Like you have to handle it really well or something.
Because I'm not a nurse, I wouldn't be able to go into that.
Okay.
I apologize, but I do know that they have said that it is, different. They're learning to work with a needle that they haven't worked before. It requires, reconstitution, and so it just because it's not the vaccine that they deliver day to day, the flu shot they get, they know this is something new that they're having to learn as well.
It's just a little new and it's very fussy, right? Like it just needs really particular conditions. Yeah.
Yes,
Yeah.
exactly.
Because it's a different kind of the technology for the vaccine is different than other vaccines
Yes.
that we've had.
Mhm.
Yeah.
Yeah.
Okay. All right. So how do we decide who gets vaccines and when they get them?
Sure. So that is at the basic level, the federal government says so. To elaborate a little bit on that, though, the federal government works with an advisory committee that set the guidance for priority populations. And then each state had the opportunity to review those. And in our case, Missouri decided to adopt that guidance. And then because the state is the one who is approving who gets vaccines, they do so with when we give this to you, you will follow the guidance, the priority populations that we have set. And so just a little information. I know lots of people are like, well, how did they even come to that decision? I did look into it, and it had a few factors that they reviewed. Sorry. So maximize the benefits to minimize the harm. So when we're taking care of people, we're using the best available data to promote public health and minimize disease and severe illness. So, how are we going to make sure what we're doing provides the best good overall? Then mitigate any health inequities or reducing health disparities and the burden of COVID-19 disease and death. Promote justice. So we're going to treat affected groups, populations, and communities fairly, and then we're going to promote transparency. So when the decision is made, it's clear and understood and open for review.
Okay, so just to clarify, so right now the reason that the reason that the sort of at the federal level they've decided, and then at the state level adopted, and then at the local level we are following the guidance
Yes.
that prioritizes patient facing, so people who are interacting with patients and are likely to be exposed to COVID with
Right.
the patients that they are treating, and they cannot do that work remotely.
Right.
And so those healthcare professionals are being prioritized, as well as long-term care residents and staff, because those are the people who are either most likely to be exposed to and affected by COVID, and or the most likely to be affected with severe illness or death from COVID, right?
Right.
So
And
those
in
are the
that
people
case,
most
a combination of even.
Yeah. Okay. Yeah. Thank you. So when we're vaccinating providers first, patient-facing providers, we are protecting them, and we are also protecting their patients, right?
Exactly. Right.
And so we're sort of maximizing good there. That's the idea. And then, of course, with long-term care facilities, the residents tend to be very, very vulnerable to severe illness and death. So yeah.
Right.
Okay. And then with every phase, I mean, that's sort of what we're looking at, right? That's why essential workers are in 1B, right? And we're trying to get there, and as well as all adults over the age of, is it 65 or 75?
So that is a kind of a 1B currently in the state of Missouri is any adult over 65. That federal advisory committee that I talked about has come out with updated guidance that says there's now 1C. So 1B would be 75 and over, and 1C would be 65 and over. It's not been adopted by the state of Missouri. We're closely watching that in Columbia, Boone County, and we'll mirror whatever guidance that the state adopts. But for now, yes, 1B is 65 and over.
So things are changing on the ground day by day, is what you're saying.
Yeah, and that's what we want to know. We want to do better, and so as more information is available, and we learn how the logistics are occurring of getting vaccine into individuals, ideally you would change as you learn more information. So I think it's a good thing. I know it's a frustrating thing because people they're always changing the rules, but it's to improve the process for sure.
Okay. Yeah, I think that's important to hear and important to say. So
yeah.
I might have asked this in a different way already, but who are we vaccinating right now?
Sure. So the entire state of Missouri is still very much in 1A, meaning long-term healthcare facilities, residents and staff, and then healthcare workers who are patient-facing. This means dental clinics, optometrists, residential care nurses, pharmacists, and things like that. The state has said that if your community is done with 1A, but the next county over is not, we're just going to push more vaccine to that county that's not, and we're not going to move to 1B until the entire state of Missouri of 1A population has had an opportunity. Obviously, not everybody wants it for various reasons, but they need to at least have the opportunity before we can move to 1B as a state. And that's the state managing its resources, again, to not let just one community who had a whole bunch of more infrastructure in place and ready to go be able to move on, and then creating an equity to the neighboring communities that didn't have that.
Hmm. So we are actively, as we've said, reaching out to and making sure that our entire 1A population in the entire county is getting vaccinated, right?
Yes, absolutely. Columbia Boone County Public Health has been providing vaccines. MU Healthcare has been providing vaccine to their staff. Boone Hospital providing vaccine to their staff, and then other entities such as those pharmacies that I mentioned. So people are getting vaccinated in Boone County and have been for over a week, maybe even 2.
Yeah.
So.
I did ask you, when will nursing homes or long-term care facility residents be getting vaccinated? That's a question people are asking a lot. And as we discussed a little bit earlier, that's already happening. Can you talk about that just a little bit more?
Sure. So it is ongoing. You may have heard that there was a national program kind of put together that there were agreements put in place with Walgreens and CVS to reach out to every single long-term healthcare facility and give them an opportunity to contract with them. And by that, it's free of charge. So just basically entering into an agreement that they will allow them to come into their facility. And so that is happening. Walgreens and CVS are coming into long-term healthcare facilities in mid-Missouri and providing vaccine to those patients. And we have reached out to all of those long-term healthcare facilities as well and just said, we want to make sure that you are getting what you thought you would get. And then if not, if you for some reason did not get reached out to by Walgreens or CVS, would you like us to come to you? And a local pharmacy also did that. So we know that vaccines are being provided to our long-term healthcare residents.
Okay, that's so good to hear. And speaking of, how can people find out when vaccines are available for them? Should they just camp out in front of the health department from now until they get a shot?
So to go off the camp, my campy response is stay tuned. But no, please don't just hang out. One, that would promote the spread of illness.
Right.
And then even the virtual hanging out by sending emails and calling, while we always have our open communication with our residents in Boone County, that would just take somebody away from providing the logistics being put into place. So our message has been that as vaccine becomes available for those identified populations, that we will reach out to those identified populations. So we did send out emails to, the Missouri Dental Association and said, please send this information to all your Boone County members. So we are actively pursuing those priority populations, making them aware of the various ways they can receive vaccine and how to get in line for that. And so as we move to the next phase, similar efforts will be made through several communication channels. You might see press releases, social media, email communication directly to you, and many more.
Yes. And speaking of, I just want to push, on the day that we are recording this, we now have a webpage that you can go to on the Public Health Department site. So it's como.gov/COVID vaccine. And there you will find information, some of this information that we're talking about right now, as well as a link to a survey that you can fill out so that you will be notified when vaccine is available to you, right? So that's como.gov/COVID vaccine. You can also email, as Rebecca said, you can also email covidvaccine@como.gov. You can also call the health department for information, over the phone, but you can email covidvaccine@como.gov if you are somebody who needs to right now get a link to that survey so that you can be included in our sort of database of people that need to be vaccinated for right now.
Right. Mm-hmm. And any information that we collect, we don't keep it and just say it's ours and nobody else can have it. We're always collaborating with our community partners. And that right now, that is especially those other entities that we know of that have received COVID vaccine. We're sharing anybody who's expressed interest in meeting that eligibility. We're sharing their information. So if we don't have enough or we don't have it yet, that we're sharing it. So if another entity does, they can call you directly themselves to schedule that.
So if Boone Hospital, for example, has enough vaccine and somebody has contacted us, like a healthcare provider, an optometrist office, let's say,
Sure.
has contacted us and we don't have the supply right now, but Boone Hospital does, Boone Hospital would contact them and say,
Yep.
let's get you guys vaccinated.
Exactly.
Okay. All right, cool. So what is the timeline here, Rebecca? When can we expect to be moving into the next phase? Like, when is my mom going to get vaccinated?
So this is especially hard for me since I am a planner. I want everything to be very detailed. And so I know it's frustrating, but that is just too hard to estimate right now because I don't know how quickly the manufacturers are pulling together more supply for us. And so I just can't tell you what that looks like. I can say the further we get out from the initial approval, the more we'll see entering into the market and the more availability the vaccine will become, the better we will be at moving it through the line. And so we hope to see extra phases coming on soon. But all of that is dependent on the availability of the vaccine. That's the kind of underlying thing that's just keeping the process for what feels like slow right now, is that there's more people in 1A than there is vaccine available right now.
Thank you so much for saying that and for saying it in that way, because I just want to underline that a little bit because, one of the things that we see like nationally and locally is this is so slow, right? People say that at the current rate, it'll take us 9 years to vaccinate as many people as we need to, but it's not going to go at the current rate, right? Like it's not just a rollout, it's a ramp up, right? For manufacturers, et cetera. Okay.
Yeah.
Yeah. So school teachers, childcare facilities, like they're on the list. We want to vaccinate everybody. It's just that we don't know when we'll have the supply to do that.
Right. And, in the beginning, all we heard about was Pfizer. And then we heard, well, now Moderna is. So we went from one manufacturer to now two. And, that doubled, for lack of a better, word, the amount of effort going into it. And so every day, every week, every month, more is being produced. And then as more is produced, more resources at the community level will go into giving shots.
Great. With what we have right now, do you have any idea how long, like with the supply that we have sort of in the community right now, do you expect that we'll be able to vaccinate the entire 1A group with the supply that we have in county now? Is that something that you know or don't know or anybody knows?
That's not something that I know. I have access to view all of the people who have expressed interest, and I can say that we don't have enough vaccine providers saying we have vaccine to give it to all of those individuals. So right now, I don't think if we just stopped receiving vaccine today and just gave shots for everything that's left in freezers, that we would have vaccinated the entire 1A. But more vaccine might be coming into our community tomorrow, and so that answer would change.
Got it. Right. Thank you. So we talked a little bit about this, but let's just touch on it again. Can I sign up for the vaccine? Can I get in line now?
So as you mentioned, Jenny, just today we started a way to kind of collect information for you to tell us, Columbia Boone County, and then as a result, all of those community entities that, one, I am absolutely interested in receiving the vaccine. And then if you would like, you can provide additional information about your person that might give us some information about what eligibility tier group you would fall into. And that will allow us to push information to you when it becomes available. Like, yes, you are high risk and you're over 65 and we are ready to vaccinate that tier group right now. And so we're reaching out to you directly. And so that's going to that website, and you'll have to repeat it, Jenny, to sign up for it. And then on top of that, we're reaching out to businesses knowing we can get more bang for our buck. If we go to a business that says we have 20 employees who are interested in this and they are essential businesses. And so whenever we move to essential businesses, we can just reach out to those businesses. And so they're giving us information about how many individuals are interested as well. So there's kind of two different ways that we can get more information out to people and then also be direct and focused with our communication.
Right. So I will repeat that address. It's como.gov COVID vaccine. And that's not a way to put yourself in line, but it is a way that you can, check a box that says, I am, over 65, I am over 75. I have one of the conditions that puts me at higher risk for severe illness or death from COVID. And, by having that information, which we are certainly not going to, use for any advertising purposes, but just to alert you to say, we are now vaccinating all adults over 65. Here's how you can get your vaccine.
Exactly.
So again, you're not in line per se, but you will be notified. You don't have to just wait, make sure that you're checking Facebook every day or anything. We will send it to you. And that's at como.gov/COVID vaccine. So, all right. So here's a question. Is the vaccine mandatory, and will it be mandatory?
So I have not heard any government entity say we're going to mandate COVID-19 as a vaccine. So I have not heard of that. So no, it's not mandatory right now. And I've not heard any discussions that it will become that way. That's not to say that your employer might make it a condition of employment, because they have experienced a lot of loss of production because, their staff has either been sick or staying home with a sick kid. And so they obviously want to be as proactive and mitigate future absences. And so they may require that, or to protect the clients or the customers, that they can ensure that the staff that they're employing isn't also transmitting disease. So it may become an employer decision, or if like you belong to an athletic club, they might require it for their members. But as like the government at any level, federal, state, or local, at this time, I've not heard COVID-19 becoming a mandatory vaccine to be a citizen.
So the government is not going to mandate this vaccine, but private entities do have the right to do that, it sounds like.
Yeah. Mm-hmm. And you can work at places where they require the flu vaccine if you're going to work there, or sometimes public schools you have to get X, Y, and Z vaccinated before you start kindergarten. So these might fold into that at some point, but just an overarching, to be a citizen, you must get COVID-19 vaccine is not something that's been talked about at any level that I'm aware of.
Okay. And then I didn't prep you on this, but is there any cost to the vaccine? Will people have to pay for it? Can they only get it if they can pay for it?
So the vaccine distribution model is to remove as many what we would call barriers as possible. We want to make it, we as Columbia-Boone County Public Health, State Department of Health, the national government, we want individuals to get vaccinated if that is what they want to do for themselves. And so we don't want a cost to be a reason why they don't get it. And so it is being provided free of charge to all those entities. Now, and that's because, like I said, the state is delivering it straight to those sites, but they don't pay the staff to do that. And so there may be some entities at some point in time that like have a administration fee, but none of our community partners are currently charging anybody. And I don't hear of that changing anytime soon.
Okay, thank you. And finally, Rebecca, what are the next steps in this process?
So the next steps are to continue to social distance, wear a mask, and avoid large gatherings. Even after you get the vaccine, you'll be encouraged to do that, especially after the first vaccine, because you're still building up that immunity. To continue listening to more information. You heard a lot like, this is what we currently know, or this is what's anticipated right now. But because we are watching what's going on and learning from it, we might change. So just continue listening for more information as it becomes available, and then support the process of allowing the vaccine providers to vaccinate the current priority population. The more time and energy they can focus on that, the quicker they can gear up for the next tier, and be more prepared for that.
Thank you. Is there anything else that you'd like people to know? Is there anything else that you want to make sure that we're telling them?
For my role, it's just that, as you mentioned, like, we want people to know that people currently are being vaccinated, and that Columbia-Boone County Public Health's role is more of communication and collective data sharing, and then as an individual entity, we are a vaccine provider, but we're not the only game in town. So we'll continue to kind of be that coordinating communication arm. But we're just really glad that so many people want it right now.
That does make me hopeful. Well, thank you so much for your time, Rebecca. And
Of course.
yeah, and we'll keep everyone posted as we know more, because it's a constantly developing situation, right?
Absolutely, yes.
All right.
Thank
Thank
you.
you.